for having this very important hearing. Dr. Shader, thank you for your years of service in women's health space. Much appreciated. My wife was 2-star admiral in charge of all women's health in America, so I appreciate your service. And recent reports and studies show that soils examined show that hazardous waste incinerators have elevated levels of PFAS. These incinerators are disproportionately in disadvantaged communities. Toxic PFAS emissions get into the atmosphere where they can hurt children, pregnant women, agriculture, soil, air. Can continuous monitoring of any air emissions protect our communities from being exposed to PFAS coming from hazardous waste incinerators?
Thank you for the question, Senator Markey. I think the concerns about incineration of PFAS are really critical to consider, and I appreciate you raising concerns about environmental justice and the communities that live around incinerators. There are new improving methods for how we measure PFAS, and I think it's important if there is going to be incineration of PFAS-containing materials that we're carefully monitoring for the full suite of PFAS that are there. But I have concerns about incineration and what that might mean for exposures among people living in those communities, and I think those kinds of life cycle issues are really why we need to be really judicious when we're creating these highly persistent chemicals that really don't break down.
Thank you. And Dr. Shader, firefighters protect us from harmful fires, but we need to help protect them from being harmed by the gear they wear, which is full of PFAS. So firefighters are just walking around covered in PFAS. We need to protect our protectors from cancer clusters in firehouses. Dr. Shader, is it true that PFAS in firefighters' turnout gear and firefighting foams can harm their health?
Thank you for that question as well. There's a huge concern right now among firefighters about their exposures to PFAS. As you said, that can come from the firefighter turnout gear, which has typically had a PFAS Teflon layer.
So are there alternatives?
There are alternatives, and actually our state of Massachusetts just instituted a ban on PFAS in firefighter turnout gear, so I'm proud of our state for advancing that. I think it's an example of when we set a goal to reduce exposures, and protecting firefighters' health is critically important, that new research and development can provide solutions so that we're keeping our protectors safe, but also not exposing them to toxic chemicals.
And I think it's something that we should think about on a national level, because obviously so many of our firefighters do die from cancer, and we want to make sure that we give them the protections which they deserve. The Agency for Toxic Substances and Disease Registry conducted an exposure assessment in Westfield, Massachusetts, one of the 10 cities included in the Centers for Disease Control and Prevention's PFAS exposure assessment. While random households were invited to participate, the data collected was not fully shared with the public. Dr. Shader, do you agree that more data transparency would be helpful to allow the public to understand their exposures, risks, and pathways?
Thanks for that question. I know that the ATSDR has released summary statistics for the results of blood testing that they conducted in Westfield. I'm not familiar with the specifics.
Should that be made fully available?
Certainly the summary statistics of how people in the blood levels that they tested in Westfield residents, how those compare to the general population, what's the median level, what's the 95th percentile, those summary statistics have been made available. I'm not familiar with the specifics of the data, the extent of data release, but I, in general, think that having more information about exposures among the general population and exposed communities is helpful.
Yeah, we would want to ensure that there's total access to the information about the safety of breastfeeding for PFAS-exposed mothers, especially considering the potential health risk to children. So that would be, I think, a very important thing that we could do. And the EPA's updated draft PFAS disposal guidance document acknowledges that performance and testing data are needed to validate PFAS destruction by incineration as opposed to other novel ways of getting rid of PFAS in our environment. Dr. Fenton, do you believe that attempting standard incineration of PFAS can lead to more dangerous PFAS compounds released into our environment?
Well, thank you for the question, Senator. We certainly know that incineration can lead to release into the environment. But what I suggested earlier in my comments was that funding innovative ways to mineralize these compounds or reuse what is being released from the incineration might be useful down the road. I mean, I do think there's a place that we can still, fund innovation, and work toward a place where we're not releasing fluorine, carbon bonds into the environment.
Yep. And with your indulgence, Mr. Chairman? Okay, thank you. Dr. Fenton, do you believe that the failure of PFAS manufacturers to provide reference standards to the EPA has hindered the agency's ability to establish accurate drinking water standards for PFAS? And has this lack of cooperation hurt communities across the United States?
Sir, it has affected how quickly and how efficiently we can provide strong data, high-quality data on health effects. It has affected me personally. It has affected my colleagues. The confidential business information in some of the PFAS mixtures has really hindered our progress in understanding the health effects. That is probably the number one issue that I've had to deal with, is the inability to get standards for some of the new compounds that we'd like to study in North Carolina in particular.
No, thank you. And it's absolutely
Thank you.
critical. I had my first date with my wife 40 years ago in 2 more months, Mr. Chairman. And she was explaining to me, her mother had died from breast cancer. And she was explaining to me that her interest in medicine was driven by that and having to go to the Stanford Hospital day after day as a girl with her mother for the treatment. But what she explained to me was this, that Japanese women contract breast cancer at only 1/3 of the rate of American women. But Japanese women contract breast cancer at the same rate as American women in the first generation that they live in America. Meaning that we're doing something to ourselves with our environments. What we put into our food, what we put into our water, what we put into the air. We do it to ourselves, and it causes a much higher level of cancers in our society. So we just can't deny these statistical realities when we compare ourselves to the rest of the world. And while manufacturers might want to just continue business as usual, the impact is then felt by the families, the women, the children, in our society, the firefighters who get exposed and ultimately succumb to the diseases. So I thank you so much for this very important hearing.
Well, thank you very much, Senator.